guys, welcome to Let's Talk Radiography, the place where we talk about anything and everything. So, guys, we haven't spoke about masters. Guys, I've been asking people, PhD people and people, professors, I've been asking them, and shame they've been giving me information. But remember, guys, with me, it's an a joker. It's an a joker. So, let us through. Anyhow, so if you wanna do a master's, I have heard you have to have your honors. Other universities, if you did at your degree at a technical like CUT, Central University of Technology, you can do your masters without an honors. There they don't need an honors, but other universities like UP, you need to have honors, right, in radiography. And then after that, you need to get your 2 years experience in clinical. And then I have heard also they want to see, they want to have someone that gives them, that vouch for you that you are capable of doing masters, that writes a letter for you. But also you have to have a topic that, you're going to do that research proposal on. And then what many questions that we get, that I have had also on myself, that is, what is the benefit of doing masters, of doing PhD, of doing, all of those in radiography. So the most one that we have came across is that masters gives you that ability to go and become a lecturer, right? And also the position you get to that level, and also you get to have this advanced knowledge. You get to know more about your your clinical or your patient care management, anything that is radiography based. You get to know more knowledge about it, right? And then also career growth. Guys, there's people that like saying, what's the point, what's the use, because we want money. And yeah, but remember, with masters now, it's another addition to your CV. That CV is very important, right? And then also I don't know if you work having masters, if there's more money. I'm not sure. Maybe people will comment, those who have masters, those who have PhD. But I think if you have masters or PhD, you can be in a clinical manner, because I think you only gonna most likely get the same salary unless you go to the teaching route. So also they say you get to train others, which is nice, meaning you won't be able to, you won't even have to lift patients. It's your way to leave the clinical part and go to the non-labor side. And also I've had this lecture or this PhD, it was a lecture that it was not for radiography. She was telling me, okay, it's nice because nowadays, since COVID, you can do online classes, meaning you can still attend your important things. And remember also, because I was like asking her, isn't it difficult though? Every day teaching people, you have to be prepared, you have to give tests and everything. And she said, you know what? You give the same lecture every year. You give photosynthesis, you give skeletal what. So automatically it sticks in your head. It's automatically, you can even say it in your sleep. So you don't, at some point, you know what you're talking about. You don't struggle. I guess the struggle is only for the first time when you start lecturing students, but with time it becomes so easy. And also you get to have international recognition, guys. Also your name will be there on those articles. Imagine Charagano Daisy Mokwa. Yes, I've seen some articles that I saw the names of my previous lectures at Central University of Technology, and I was like, oh my gosh, I wanna be there one day. I wanna be them one day. So guys, if you wanna do masters, don't listen to people that tells you okay, it's not important what they use. You're still gonna get paid as me. What people are so negative, people are so demotivated lately, it's not even funny. Do not listen to those people. Know what you want, go for what you want, do what you want. Because in this career, you need to uplift yourself, right? Okay, guys, so if there's anyone who has more details on this master's and PhD and prof, and most importantly, the money, if you can give us those challenges, maybe that will motivate people to go for masters and all that. But you guys don't want to give us the range, Clever, too. Phew. Anyhow, thank you very much. Bye.